Testosterone replacement therapy in women, part 1, determining if there is a deficiency. TRT is being shoved in everybody's faces right now. Everyone is saying it's life-changing, and it absolutely can be. However, we need to make sure that we're looking at responsible administration techniques and practices. Yes, it is important that we're looking at biofeedback, and normal doesn't mean optimal or good or even reasonable in a lot of cases. But now we're seeing providers, especially med spas, clinics, people trying to retain or gain new patients, explain to women that have perfectly normal, healthy ranges of testosterone that they're deficient, or that word I love, suboptimal. A range of approximately 20 to 40 nanograms per deciliter is perfectly acceptable and normal, and in some cases even ideal for many females. Now, you may want to leverage higher levels if you are an athlete, a competitor, or potentially trying to artificially inflate your libido. But if you feel horrible on a daily basis, suffer from fatigue, and you have normal, total, and adequate free testosterone levels, then TRT is pretty much going to be a band-aid treatment. There is medical necessity and utilizing it for performance purposes. Neither one is wrong, but it's important to understand what category you belong in. Let's say your levels are actually low and you're symptomatic. We need to address this, but it doesn't always mean jumping to exogenous hormones that are going to be much higher risk in terms of virilization and side effect potential. I always recommend looking at your protein intake, whether you engage in strength training, sleep, lifestyle, checking your ferritin, your vitamin D, as well as your DHEA sulfate. Or maybe you're on a hormonal contraceptive. There's a lot of variables we want to take into account and either eliminate or correct before jumping to exogenous hormone treatments. Part 2, we're going to be looking at natural corrections, and then part 3, we're going to be looking at the different types of TRT administration for females.